Officially. Good afternoon and welcome to our October Plan for Health peer call. This is Elizabeth Hardig with the American Planning Association, and I just see a couple of folks still entering the webinar room, so I'm going to run through a few housekeeping items before we officially kick things off. For those of you who are not part of a Plan for Health coalition, this of course is one of our many training and TA opportunities. For a recording of today's webinar or other conversations and training events, please check out our website, plan4health.us. And you know what, I'll go ahead and chat that into the box just in case it's not automatically saved in your browser. This afternoon we'll have a fairly small group, so you're welcome to ask questions directly to our guest speaker by unmuting your line, or feel free to use that chat box right on the right-hand side of your screen. So today's discussion will, of course, be focused on nutrition and increasing access to healthy foods. We do have a special paper that's available for download right there in the file pod. So just below the chat box, if you select download file, you should be able to see Dr. Chrisinger's paper, and we'll, of course, be talking more about it during the call. All right, so to officially get things started, we have Dr. Ben Chrisinger here. So Ben is an urban planner by training and is committed to research that helps us understand relationships between the built environment and health, especially health disparities, which I have to say is exactly what Plan for Health is about, so we're excited to have him on the line. Currently, Ben is coordinating a research partnership between Dr. Abby King's Citizen Science Initiative with stakeholders in Camden, New Jersey to assess the city's Healthy Corner Store initiative. His previous research examined efforts to open new supermarkets in underserved areas, or food deserts, by considering development processes, store-level outcomes, and community and customer experiences, which is really what we'll be talking about today. So we're excited to have Ben here with us, and with that, I will turn things over to you, Ben.
Great. Thanks, Elizabeth. I really appreciate the invitation, and I'm excited to talk to you all about some of this research that I've done over the last 3 or 4 years. But just a little bit of background about me. Like Elizabeth said, I'm a city planner by training. Now I'm a postdoc with Stanford Med, and as I explained to my parents, postdoc is not an additional degree, but it is a training program to extend sort of my city planning research skills and gain some additional health research skills by working with folks in the Stanford Prevention Research Center. I've always been interested in this question of food access and health connection, believing kind of intuitively that there has to be a relationship there, but knowing that it's probably more complicated than just charting the distance to the nearest supermarket. And connecting those things would be the role of behavior. And I think behavior being particularly interesting to me because both as a planner and then as someone interested in health, behavior is sort of what connects those things. And I think anyone on the call who's a planning practitioner or a public health practitioner, both of you sort of think about human behavior a lot, I'm sure. And then also, I became interested in this topic specifically because supermarkets are really the biggest, most expensive, and potentially the most influential food access intervention that we think about. Supermarkets bring a lot of fruits and vegetables to neighborhoods, but they also bring a lot of soda and other things. So the level of impact of a supermarket being developed can really be different compared to some other interventions like food trucks or corner stores. And I've done a little bit of research on those as well, so we can maybe talk about that later. For the dissertation research, I also did some shopper interviews in a store developed through the Fresh Food Financing Initiative in Philadelphia, Pennsylvania, and also looked at some area-wide SNAP redemption data to see, were low-income people shopping in these stores once they were developed. So I just mentioned that to kind of give this some context, but what I'll be talking about today is really, I'll be briefly talking about the findings from this paper, and you all are welcome to download it for free here or direct anyone else to the Federal Reserve Bank of San Francisco website, and we can provide you with that link and check it out for yourself. And then I'll transition into sort of what do these findings mean for practice. what could these mean on the ground um, for doing these projects. So let me advance the slide. So basically, you all, I'm sure, are very familiar with this idea of food deserts, but also the policy that has come out of our interest in food deserts. So folks like PolicyLink and the Food Trusts, I'm sure many of you are familiar with those names, really spearheaded this effort over the last decade to put together financing tools, financing processes, community processes to become to sort of rally around this interest in developing new large food retailers in these places called food deserts. And also part of this motivation was that we thought there was a health connection, right? So these areas often have high rates of diabetes, hypertension, obesity. So there's a really direct implication for human health in that policy. And as we see a very youthful President Obama here, sort of celebrating this initiative to revitalize communities through supermarkets. I'll say that in assessing or trying to assess what is out there, what are all the different types of policies, programs, stores that were developed, it was far more difficult than I thought. Even among the programs that do report where the financing goes and who's won grants or bids for financing to develop new stores and supermarkets, it's tough to trace that money. And I don't mean that in a sort of nefarious way. I just mean that there's a lot of different levels of governance involved here. There's a lot of different stakeholders. And just there's not a comprehensive clearinghouse of these types of projects. So that was sort of my interest and initial effort in doing this paper, was to try to put together some kind of database to make some kind of conclusions about how these projects were going in the U.S. So here's sort of a short list of the types of incentives that I found represented when I looked across the U.S. And I guess I should also say that I defined the food desert intervention or a new supermarket in a food desert pretty broadly. So anytime a project receives special public or philanthropic assistance to open a store in a low or an underserved area and had food access or improving health as one of the motivations, I counted it. So some of these were very directly involved. The Healthy Food Financing Initiative, for instance, was at the federal level, and then things like the Pennsylvania Fresh Food Financing Initiative were at the state level. The New Orleans Fresh Food Retailer Initiative was at the local level. So we see all levels of governance really represented in different types of incentives. And then things, if there are any community development practitioners or planning practitioners on the call, things like tax abatements, zoning, community and economic development funding, like these are things that are kind of the bread and butter of local, especially urban governance and development. So many of these things existed before fresh food financing existed, though they were repurposed or many times streamlined to go towards those types of projects over the last 10 years because we became interested in food deserts. I found that projects opened I guess increasingly over time. I guess that's the best way to say it. I will say that around 2010, 2011, that's when the federal financing for fresh food, or for the Healthy Food Financing Initiative, all of those funds started to become available. So I think that can explain part of the rise there. And I will also mention that the dip in 2015 is not some sort of cataclysmic event, but it is the fact that I graduated and I had to come up with an ending date for data collection. So I would say that I'm actually in the process of going back and trying to update this database, but at least for this figure, that's what explains the dip there at the end. Also, to explain old site means, that's the dashed line. Old site means that a supermarket was developed on where a former supermarket was. So fresh food financing didn't just build new stores and vacant lots from scratch. It also reinvigorated or reopened stores that had shut down for a variety of reasons. And health here means that stores that included some kind of health programming in store that was beyond just having fruits and vegetables like any supermarket would have. They had things like clinics, they had things like cooking demonstrations, things like retail dietitians who were there to help customers, those sorts of things. That's what health means in this graph. Looking at where I found projects in the majority of states. There were some clusters, clear clusters here in the kind of shaded regions. Draw your attention to where those are. So on the West Coast, we had San Diego and Los Angeles having the most projects. And then we also see clusters in Chicago. There, Save a Lot received a lot of assistance from the city government to open in food deserts there. We also see New York City, which had its own local program for fresh food financing, which had a lot to do with zoning and development incentives, and Philadelphia, where the Food Trust and the Reinvestment Fund are located and kind of was the epicenter of a lot of this work, which has since been disseminated across the country. So, here you see cities, but you also see small towns, you see rural sites, and just as many projects as you see on this map, there are as many different sorts of stories and development packages that went into building those stores. But looking just to kind of get to the diversity of projects, I classified all the stores by development types, and this might be maybe a little more legible to the planners on the call, but I'll say also that here plaza simply means something that's probably most recognizable as a suburban style supermarket. You have a large supermarket surrounded by smaller stores. The supermarket anchors what's basically a large set of parking, and so the idea is that people could go to the supermarket and then hopefully go to pick up their dry cleaning or go to the bank or do something else before leaving. You can look at the paper to see what all the other classifications are, but this is just to underscore the fact that both on the y-axis here, the number of employees, and then the x-axis here, the average store size, there are big differences in terms of the impact of economic development, jobs that are created, but then also the space that's required. You can't fit a 50,000 square foot store in a 10,000 square foot space that you have available in a food desert. So all these things tend to matter. And I did look at, advancing to the next slide here, I did look at, does the funding source actually matter for the size of the store? So this looks at the different types of funding sources, and you can read a little bit more about these in the paper as well. And just looking at, is there a significant difference in the type of funding that a project received and how big it was? I'll just draw your attention to the New Market Tax Credit, that's NMTC. That was the bulk of the federal government's commitment to building new supermarkets in food deserts. And that is, when projects received New Market Tax Credits, they were significantly larger than average when we look at all the different projects. And I think that a lot of that's reflective of what types of projects New Market's tax credits go towards. They're large projects, multi-million-dollar projects. And so this is, again, just to underscore the fact that we have a lot of different food desert efforts going on in the US right now. So the really key lessons for practice here, like I said, different financing sources mean different types of stores with really big differences in the tax credit programs and then also the grant programs. So if you're looking back at that other slide or checking out that paper, the Health and Human Services, the Department of Health and Human Services at the federal level was another part of the Federal Healthy Food Financing Initiative. Those grants went to smaller projects, so it's not a monolith here. Also, many of these tools existed in other forms before these food desert interests. So again, the Health and Human Services grants, the New Market Tax Credits, these aren't new tools. These aren't new funding sources. They were repurposed. And in some cities, again, zoning, rezonings, or development incentives, those existed. A lot of this is the packaging, so putting these incentives together or streamlining or putting staff towards these initiatives, that's the biggest change that we saw. And then finally, which I think is going to be maybe of interest to people on the call, is that health promotion is really rarely, if ever, tied to financing given to supermarket operators. So a couple of times there are performance targets that are required as sort of a performance-based loan, but that's around things like the number of jobs that a project creates. So, this has been talked about before in terms of like a social impact bond or things like that. The idea of like having a social good tied to incentivize a developer or someone receiving financing to deliver on these targets. But really, that's only beginning in fresh food financing, and I think we could talk about that maybe more in the Q&A. I also wanted to just okay, so we have this landscape. We know that there's big differences. Just getting back to maybe a more, 500,000 foot level, of looking at, so what does that mean? And I just wanted to put forward just a model for thinking about that. So if this is how we could improve health by opening a new store, and all of the things that are required. So if you look around on the top here, all these boxes are things that must happen for a new store to improve someone's health. You have to first build awareness of the store. You have to go to it. You have to try it out. You have to adopt it. You have to go back. You can't just go once. You have to go, many times. You have to purchase more healthy food and stop eating less healthy food. And then you have to sustain those behaviors over time. This issue of time really matters a lot. So we see that, days or weeks might be trying out the new store, but really in terms of sustaining behavior, that's a month or year sort of question. So this is, again, I'm not suggesting that this is how it happens. I'm not suggesting that this is how, people behave, but I am saying that this is how a new store would create health change in a food desert. From a planning perspective, there's a simultaneous process, right, that goes back way before the new store even opens. You have to do your pre-development, you have to do your development, and then the store has to operate as a normal business, right? So it has to pay back the loans that it took out to develop itself in the first place. So placing these side by side, it begins to look pretty complicated, but it's going to get even more complicated when we throw in some factors that have to do with just everyday life. So, overarching factors like whether or not the food stamp program is being robustly funded, or if we're going through a recession, or if you have maybe great partnering organizations in your locality and your local government's really on board. Or maybe you're a small town and these robust players aren't necessarily present, or the financing just isn't quite available. There's all these connections that we could start to draw in between the pre-development phase. For instance, if the pre-development really engages the community, more people are going to be aware of the store. If it matches what people really need, more people are probably going to adopt the store. But then also I draw your attention to what fresh food financing typically deals with is on the pre-development phase. So it's really on the phase of finding that site, getting it secure, developing it in a way that makes sense financially. For this question of normal business operations, fresh food financing really tries not to go into that space. And I would just suggest that, if we again look to this top side of looking at what individual behavior has to do, fresh food financing can play a role there, and indirectly it certainly does, but we can also see a lot of gaps, and I'm sure you all can imagine a lot of challenges or potential barriers that might be popping up for individuals in those spaces. And I guess I would just encourage us to think about all those relationships as we're imagining how planning and public health could work together. And I'll just end with this to say that I think it's important to do that, because if we don't do that, we don't draw those connections between things, we end up sort of blaming the wrong people, or we end up sort of looking to the wrong people to make projects work. So here in the Pittsburgh area, they opened a new Shop and Save in a food desert, and the Pittsburgh Post-Gazette sort of headlined this statement recently and said, or not recently, but after it opened, it said that now the grateful neighbors have to do their part. They have to patronize the store to keep it a winner, which again is like not such a bad thought, but at the same time, the individuals who live in the food desert really aren't the ones who we should be holding accountable to make these businesses work. And if you looked at those interrelationships between factors a little bit more, I think it would be beneficial both for planning and public health, but then especially for the people who we think we're helping. So I'll end there and take any questions that you have, and if we run over, I'm happy to also answer questions by email afterward. But thanks very much.
Great, thank you, Ben. That was a really interesting model that you shared, and I want to give folks a chance to copy down your email address, but then I wonder if we could go back a couple of slides and just look at all of those intersecting relationships and boxes, and I think that's exactly what we're trying to tackle with Plan4Health, not necessarily related to supermarkets, but in many of the other interventions that folks are thinking about. And you make such a great point by ending with the article and reminding ourselves that it is not the responsibility of the resident to be grateful, but in fact they should be at the table when we're thinking about interventions and plans and really having a true, authentic community engagement strategy. So I see a few folks are on the line from both Plan4Health cohorts and actually from Partnering for Health cohorts. So Plan4Health, of course, is part of a larger initiative funded by the CDC with the National WIC Association and the American Heart Association. So we've got a couple of planners, but plenty of non-planners. So feel free to unmute your lines and ask some questions or chat them into the box. And before the call, I was just sharing with Ben that Plan4Health coalitions are not necessarily working on supermarkets right now as part of their projects, but as we look ahead to thinking about continuing to work with food systems and thinking about food deserts, this is certainly an interesting paper to think about and to keep in mind. And maybe while folks are thinking about their own questions, we could look back at this model again. And I think you raise an interesting point about health promotion not being part of many of these packages, which was surprising to me to discover looking through your paper and hearing it, of course, again today. And it did come up with one of the coalitions in cohort 1. So the Metro Boston Coalition initially started their project around corner stores and then really wanted to think about how they could tackle the kind of distribution at a higher level and engage grocery store owners. And ran into some roadblocks, but they did end up working with a few privately owned stores to have healthy checkout lanes and to think about how the store owners could really shift and shape the environment to encourage shoppers to make some healthier choices. I just wondered if you have other examples of that.
Yeah, that's a great point, because I think that, and in the paper I talk a little bit about this, about having different models of health promotion, because I did see stores, who were interested in this. And so just briefly, like the models that I found were ones where the store owner really wants to incorporate it into their business model. So they have to be very deliberate about including health. So for instance, in Philadelphia, Brown's ShopRite is a regional chain there, and they developed a big new store. And as part of that store, they included a federally qualified health center in the store. So they have a clinic there now for their customers. They can do health screenings and a variety of other services there. I'll mention that's interesting and great, but also square footage in a retailer, especially a food retailer, all of that translates to sales. And at least in terms of providing space to a clinic, those are sales that they're not making. So they have to come up with a rent strategy or something and incorporate it into the design. So if we're thinking about the development process, a lot of those decisions have to be made a long time in advance. In terms of, let's get that into the business model, let's make sure that's going to work out, let's secure a partnership that's going to let that happen. So that's one idea. Another idea of sort of making it part of the business model, Fair and Square, which is a nonprofit grocer that Fill Abundance. It's the regional sort of emergency food bank in the Philadelphia area. They opened a nonprofit grocer in Chester, Pennsylvania, and they can focus. They can provide a little bit more of a focus on healthy, fresh foods because they're a nonprofit. So their profit model is not necessarily like we just have to sell things that make money. They do have to make money, right? They still have to pay their staff. They still have to pay, keep the store open. But they can also afford to make some choices that maybe a conventional grocer might not feel so comfortable with. The other models were things like partnerships with community health centers or university hospitals or things like that. So we see outside Kansas City, there was a Save-A-Lot that was trying to partner with a local health organization to offer screenings or things like that for their customers. The last one, which you probably have all seen if you've been to a supermarket recently, is there's this health and wellness trend in the industry. You can evaluate those marketing claims, for yourselves, but just that it's hard to judge. I guess I'll just say it's hard to judge how much impact these sort of industry trends are going to have because they're not so individualized. They're still trying to get people to purchase certain things. So it's a question of who do you have at the table and at what point in the development process you're able to get health involved and keep health involved.
Great, thank you for sharing those examples. I'd forgotten about the federally qualified health center actually being in the supermarket. That's really interesting. We were chatting the other month on either a nutrition call or a coalition call about the trend that we're seeing with kind of the other side of that, where CVS is now becoming a mini grocery store, and so incorporating food into more of the pharmacy environment and almost encroaching on the corner store market, which is an interesting shift, and certainly when we're thinking about older adults in particular, have some potential impact there. And your point about industry trends, I think, is a good one, and certainly consumers, or at least they tell us, we're able to shape how things will be sold and have more of a voice, but I do wonder how that will play out moving forward, and if in fact these wellness programs will really continue and really benefit folks and actually make some changes.
Yeah, just to quickly follow up on that, I think a big question for me is just around expectations of the players because as it is now, I think a lot of the choice to involve health or not involve health promotion in the store, that choice falls to the retailer to say, I'm interested in this, or I want to be a leader, or it's part of my business model. But it's not a requirement. I think that's just not in the incentive structure for stores to open in food deserts. So in terms of building it in, there's been a lot of resistance to do that, a lot of resistance to sort of mandate that store owners do include health promotions. Some of that might be changing because we have more examples of successes where you have a health clinic or you have the partnering with other organizations. But I would just say that, at least in my mind, like we have great examples of how to do health promotion in stores. So I guess I'm not running a food access incentive program, but if I were, I might say, it might be time to really bring people to the table a little more seriously and say we need to see some health promotion, we need to see some partnering, and we do expect that as part of giving these incentives out.
Great. Ending with a call to action. That's fabulous, and I think that's a great thing for our coalitions to consider as the Plan4Health project starts to sunset, and as we're thinking ahead, how can we continue to engage all of the great partners we already have at the table for the strategies we've identified, but how can we kind of continue to keep the food conversation moving forward and maybe bring in some private sector folks and other folks who we haven't necessarily thought about before. So So thank you for sharing that and sharing your expertise, and we really appreciate having you on the line. And I thank you all for joining us and listening in. We have recorded the conversation, so we will post a copy of the presentation and the link to the webinar itself on the Plan4Health website. And of course, please feel free to email Ben, and you're also welcome to email me if you have any questions or follow-up comments. And thanks again, Ben, for joining us.
Thank you.